Hi, this is Brendan Cronin. I'm going to talk you through the procedure of a secondary intraocular lens insertion. This patient is asleep, like all patients having eye surgery. You don't want to be awake for the procedure at all. You just want to come in, meet the anaesthetist, fall asleep and wake up with it over. This patient had their cataract surgery done a long time ago and had developed astigmatism since the cataract surgery, so had quite blurry vision and wanted that improved. We can correct short-sightedness, often called myopia, long-sightedness or hyperopia, astigmatism, and something called dysphotopsias with these secondary lenses in the eye. They're often used in patients with a lot of astigmatism in conditions such as keratoconus and corneal transplants. So this patient still had good vision in glasses but wanted to be able to see without glasses. I've got a special lens that I'm going to insert inside the eye on top of the artificial lens that's already in there to correct the vision. You could see those green lines that appeared on the screen. That's our special computerized overlay that we see during surgery, because lenses that fix astigmatism need to be lined up at a special number of degrees to do their job correctly. You can see I make a little incision on the edge of the eye here. The eye is obviously numbed for this. I've filled the eye with a special jelly called viscoelastic to hold the eye in place. This can sometimes put the pressure up very high in the eye in the few days after the procedure, and this may need treatment. I'm going to inject the lens into the eye here. This is very routine surgery, but it is still delicate microsurgery on your eye, and things don't always go smoothly. It's possible that the lens damages a structure inside your eye. It's very rare, of course. Sometimes the lens can rub on your pupil or the iris, the structure that actually makes your pupil. This can release pigment or cause uveitis, which is inflammation inside the eye, or high pressure in the eye. These are all rare, and the lenses are specifically designed to reduce the risk of this. But of course, like any complication, it can happen, even if the risks are rare. You can see I'm just tucking the little legs or haptics of the lens in behind the pupil in this patient. And then I'm going to line up the special little lines on the lens, specifically with those green markings that you'll be able to see on this screen in a moment, to completely correct the astigmatism. Lenses that can correct astigmatism need to sit at a certain number of degrees in the eye, and if they do move from that, they'll need to be adjusted, or they won't correct all of the astigmatism that they're intended to. Patients need to use some drops after the surgery to ensure their eye doesn't become inflamed. It's very, very common for people to get dry, irritated eyes for a few weeks or even a couple of months afterwards, as it is with any surgery. We inject antibiotics at the end of the case to reduce the risk of infection, but of course infection can still happen. You can see those green lines there that I'm using to line up with the little markings on the secondary lens in the eye. It's not to be confused with the other little markings that are on the primary lens that's in the eye. You can see I'm sealing the wounds there with a little bit of fluid. I'm injecting fluid into them to ensure everything is watertight and to sharpen up that patient's vision nicely. The surgery is very routine, but it is important that you understand surgery on the eye is always microsurgery and complex, and it doesn't always go smoothly, but it is normally very routine.